Hi, my name is Afsheen Sheikh and I'm a board-certified behavior analyst and a mom of a child with autism. We are in the midst of an unprecedented situation, and being a parent myself, I can understand how deeply affected you and your families are in this current situation. The process of social distancing, although necessary, is creating challenges in supporting our children's learning and progress. Our schools, centers, and organizations have all shifted to a virtual delivery service model. Children and adults who are struggling to adapt to the drastic change in routine may need a lot more help now. Through telehealth, we can do a number of things. We can implement ABA programs, provide assessments, including a functional behavioral assessment for challenging behavior, develop a treatment plan for teaching various skills to your child, and a behavior intervention plan to reduce challenging behaviors. We can also provide training to parents and caregivers. However, in order to ensure that telehealth is effective, it is important to assess the prerequisite skills and unique needs of the child or client. Some of the prerequisite skills required for direct online therapy are basic joint attention. They have actually been provided by CAS 2020, so if you go on their website, you can have a look. The child should be able to attend to the therapist's instructions, basic discrimination, basic imitation, following directions, basic directions such as look at me, touch, select, put in, ability to sit in front of the computer for at least 8 to 10 minutes, manageable challenging behaviors. If the client does not have the prerequisite skills, then those skills will have to be taught with the help of the parent. Parent training must be provided to ensure parents are equipped to assist in this process. The second thing to make it effective is to reevaluate the treatment plan to ensure it is suitable for telehealth. If your child already has a treatment plan, it might have to be reevaluated to determine if the child's goals and objectives are suitable for telehealth. Changes may be required to be made to the goals and objectives so that they can be easily achieved through telehealth. The third thing would be to identify reinforcers and how reinforcement will be provided. It is important to have effective reinforcement in place to ensure completion of the task. A token system is an effective tool for providing reinforcement to children through telehealth. The fourth thing is to evaluate prompting procedures and materials for each program. Materials will have to be made so that they are appropriate for the session. Some new apps or PowerPoint presentations will have to be used. Similarly, more prompting might be required to complete the task. Conduct parent training to adequately prepare for telehealth. It is important to prepare the parents, to teach them what to expect from a telehealth session, identify any safety issues, and to provide guidance on implementation of interventions. The sixth and the last thing is to use visual schedules to reduce anxiety and help the client understand the structure of the session. We know that telehealth is something different and may be new to some. It may be confusing or one may feel apprehensive about it. But research has suggested that telehealth services have not disrupted treatment efficacy and is just as effective as face-to-face in-person treatment. In fact, it helps parents learn from the therapist strategies to implement programs effectively with their children, establish instructional control to increase compliance, and to improve their quality of intervention with their child. And of course, the most important advantage of telehealth is continuity of therapy and continuous progress and development of